The Applegate Cancer Center is committed to bringing you first-class pediatric transplant care. We offer a BMT team where every member is dedicated to your child's health, from the hospital stay through recovery. You can count on our team to provide the information and comfort you need. The BMT doctor oversees the care of your child before, during, and after a transplant.
As one of the pediatric bone marrow transplant physicians, my relationship and interactions with the patient and family start at the time of consultation. So a patient's physician who's caring for their leukemia or blood disorder or immune disorder or other transplantable disease will ask me to see the family in consultation to both talk to them to provide information about the transplant option, but also to evaluate the patient from a medical standpoint for suitability for transplant. That's the very beginning of that relationship. It carries through to getting ready to go to transplant once the decisions are made.
Physician assistants and nurse practitioners are healthcare professionals who have received advanced medical training and work closely with your child's doctors in managing your child's care before, during, and after transplant.
Before the transplant, we, as physician assistants and nurse practitioners, see the patients in clinic, get them ready for transplant. That involves a very complete history and physical. We also work on the patient care orders, the chemotherapy orders, and communicate with the inpatient team regarding the admission of the patient. During transplant, we are there in the beginning, kind of monitoring children when they go through their preparative regimen, which is when they're receiving chemotherapy prior to transplant. And then on the day of transplant, we're actually the ones who often will give them the transplant, give them the cells, or sometimes the morning of we'll go down and do a bone marrow harvest, which is when we're actually harvesting cells from a sibling donor. So that's one of the things that we do during transplant. And then of course monitoring children after transplant to see if they have any complications related to the chemotherapy, and then seeing children in the clinic after they leave the hospital to monitor them there.
The transplant coordinator is a nurse or other healthcare worker who helps you and your child's doctor arrange your child's transplant care. She will be one of the first individuals your family will come in contact with.
As the transplant coordinator, I'm the first contact for the families. I help set up the initial consultation for the transplant physician for them to come in and discuss transplant as a treatment option for the patient. I also keep in touch with them pretty consistently to help determine evaluation dates, donor workup dates, admission dates. I hope that parents know that they can always get a hold of me on the phone, pager. I'm always available. Should they have any questions, I'm the one to contact.
We understand being in the hospital can cause a financial strain for any family. That's why we provide you with access to a financial counselor. During the BMT evaluation, the counselor will review your current insurance policy for how it pertains to transplants. She will also go over other programs that may offer you financial assistance.
Once a patient is clinically referred for a bone marrow transplant, then the case is turned over to me and I complete a financial assessment to determine if there's adequate coverage, financial coverage that is, to stand up against the proposed clinical treatment. We have a specialized financial team specifically for the financial portion of transplant services. So I may be reaching out to our managed care department, our billing department, our patient accounting department, along with the resources that the social worker has available, different community programs that may be available, along with the several Medicaid programs that may be available that families may qualify for that they just don't know about.
BMT nurses provide daily care for your child.
As an inpatient nurse, we take care of the patients during the transplant phase. We assist patients and their families with their diet, the BMT diet, changing central line dressings, administering medications and blood products if needed. And we also are there as a shoulder to cry on if it's needed.
And then in the outpatient clinic, prior to transplant, we're seeing them in consultation and we're seeing them during the consent visits, in which time we're going over everything that they're about to undertake and make sure there are no questions or any concerns. And then we also explain our guidelines so that everybody's real clear, because we do have strict rules during the transplant period.
A research nurse coordinates treatment and testing of children enrolled in research studies. She also collects information on patients enrolled in studies.
It is beneficial to the patient to be on study if at all possible, because sometimes these studies give the latest treatment that's available.
Undergoing a BMT can be a stressful experience for your child. Our child life specialists are here to help ease your child's fears and anxieties. Child life specialists are trained in communication skills and age-appropriate learning techniques, so they can explain what is happening in a way your child will understand.
I try to be with them every day, every other day, to help them not only to provide normalization, but also to provide therapeutic activities and make sure that they're coping okay.
Children's is one of only a handful of pediatric healthcare systems in the country to have a music therapist on staff full-time.
Very simply, music therapy is using music interventions to address non-musical goals. Some of the things we can work on with music therapy, there are kids who need to increase their respiratory function, which sounds very medical and clinical, but playing a harmonica isn't that to a kid. So you hand a kid a harmonica, that we can work on some respiratory things. If they have something that they're very upset about, they're grieving something, whether it's their own illness or another thing in their life, creating a song, writing a song together, and being able to create it and see the finished product.
Our social worker provides guidance and counseling to help your family. She will help you arrange the basics of everyday living while your child is undergoing a BMT, and will provide support for any emergency matters that may arise.
As a social worker in the BMT unit, it's my responsibility to help families get through this process. And what that can be is getting the resources financially, educational resources to help them understand and cope and pay bills through this process. The other part of it, I think, is to really kind of look inside yourself for what strengths you have to help you and your child and your family members get from point A to point B.
A Georgia certified teacher will help your child keep up with schoolwork while in the hospital.
When the kids come here for transplant, we work with their school and or their homebound teacher to make sure that they stay on track academically, so that when they leave transplant, they're not behind academically. They can go right back into where they were when they came out of school.
A psychologist can help you and your child cope and find ways to deal with the stress of a transplant.
Clinical psychologist has a very important role in helping families and also children navigate the psychosocial stressors of working in the context of having a bone marrow transplant.
Some families find it helpful to discuss spiritual issues with one of our hospital chaplains, or to spend some quiet time in our chapel, which is located on the ground floor and open 24 hours a day.
I am a chaplain, and I serve the Applegate Cancer Center and Blood Disorder Service, which includes the bone marrow transplant population, and I work with patients and families and staff of all faiths or none, supporting them spiritually. It's befriending and being there to care for them in that whenever they need you, for whatever reason.
After a BMT, eating right is more important than ever. Your nutritionist will determine your child's needs based on his growth and development patterns, and will then develop a health eating plan you can follow at home.
I look at the growth, see where they're at, or their past and present growth and their state of nutrition. And from there, kind of make a plan as to what do they need to give them the nutrition as far as calories, protein, and other nutrients, and go from there.
A physical therapist works with your child on exercises to keep up strength during the transplant.
We work with the families and the caregivers to establish regular daily exercise for these kids. Determined based on the child's age and their developmental level, we'll come up with an activity plan. So that may be for the older kids, it might be completing their daily 10 laps around the nursing station, or it may be for a toddler, helping them to ride a tricycle. Or for a baby, it may be working on developmental milestones that they would typically be working on at home.
The Applegate Cancer Center supports every aspect of transplant, providing guidance and answers when you need them most.